In these last years, because we need to have very good and performant units, we push towards introducing this cosmetic tool to have the balance between what we think is the ideal number of recurrences and the best possible aesthetic outcome. To have that, we need to have an objective tool. And this objective tool clearly should not be patient evaluating or the surgeon that performed the surgery evaluating the result, because again, it's biased. So it's been a very, very interesting cooperating work that lasts at least 12 years between me and Professor Jaime Cardoso from INESC. And we developed using machine learning techniques a software that is capable of automatic or semi-automatic evaluation of the aesthetic outcome, having very high reproducibility values. So I can use it here or elsewhere, and it gives us always or almost always the same result. So it can be used to give us the balance between I can take the amount of tumor I can and I need to, but on the other hand, I have good cosmetic outcomes. Every time you introduce a new machine, a new technique, you need to test if the result is better in terms of survival, but also if it is better in terms of cosmetic outcome. And this, of course, it has flaws, but it's getting better and better, and it's so good that every week we have 1, 2, 3 new users from around the world that ask us to have the software. The most frequent form of breast reconstruction is with implants. The second best option is using our own tissues. In the last 50 years, what we call the free flaps came around. So free flaps use only the fat of the abdominal, linked with small vessels that we are going to ligate in the place of the breast. With the imaging techniques that we use nowadays, we can see where the vessels are, and they give us a map of the vessel that exists in the abdomen. So we mark it on the skin, and during surgery, we operate the patients and we go for these vessels that are the larger ones and the better placed ones. This process takes about 3 or 4 hours. What we did with INESC is to try to get a automatic detection of the perforators. So we give them the CT, they have an algorithm that detects the difference in contrast between the vessels and the rest, and they delineate the vessel without any human input besides the first one. That is done in 10 minutes. So the result is very positive and it spares a huge amount of time. So this is the other project. It's another tool that I think it's not going to be useful in this breast reconstruction, but in any flap that we will use microsurgery.